Hi, I'm Dr Elisha Broom. I'm one of the maternal fetal medicine subspecialists here at Queensland Ultrasound for Women. We report and review all of your ultrasounds here at the practice, and I was hoping today to just touch base on pre-eclampsia, which is a common disorder that affects 5 to 10% of all Australian women during their pregnancy. So what is pre-eclampsia? Well, pre-eclampsia is a multi-system disorder within a mother that occurs primarily because of the early placenta. It happens because the early placenta develops and implants not quite in the right way, and this results in a high resistance placental circulation and also a placenta that releases factors into the mother's bloodstream that increase her blood pressure and also impact the other organs. Pre-eclampsia will impact both the mother in pregnancy and the baby. The mum may experience symptoms and signs such as headaches or spots and flashes and visual disturbances. Mums may find that they have extra swelling in pregnancy, abdominal pain, or just feel generally unwell. And from a baby's point of view, that placenta that hasn't quite implanted and developed correctly can increase the risk of growth restriction or small for gestational age. If you are diagnosed with pre-eclampsia, your doctor will carefully counsel you about this, and there'll often be extra surveillance in a pregnancy. And part of that extra surveillance that's really important is ultrasound surveillance so that we can monitor the appropriate growth of your baby. So who is most likely to be at risk of developing pre-eclampsia? Well, research suggests there may actually be a genetic predisposition to developing pre-eclampsia, and this is why sometimes it can run in families with mothers or sisters of patients who have pre-eclampsia, having also been diagnosed with pre-eclampsia themselves. However, we don't quite know exactly what this might be yet, and so at the moment, our best bet is by looking at factors in your history or doing pre-eclampsia screening early in pregnancy. Factors in your history that can increase your risk of developing pre-eclampsia are medical conditions. Things such as pre-existing high blood pressure before your pregnancy, diabetes, or maternal autoimmune conditions can all increase the risk of you developing pre-eclampsia, as can a history of pre-eclampsia in a previous pregnancy. So can you screen for pre-eclampsia in pregnancy? Well, yes, you can. At QUFW, we offer pre-eclampsia screening to all of our mums at the time of their either combined first trimester screen or early structural scan between 11 and 14 weeks in your pregnancy. We perform this risk screening with some features of the ultrasound, your blood test results, and factors of your history, and those go into a risk calculation package which will give you a risk of developing pre-eclampsia before 37 weeks. A high-risk result would be considered to be greater than 1 in 100, and if you received a high-risk result at the time of your scan, you'll be seen by one of our QUFW doctors, either in person or via telehealth, to discuss further any questions you might have about pre-eclampsia, to discuss risk reduction strategies, and then we'll of course provide a report to your doctor so you can explore this more with them. So what are the risk reduction strategies for pre-eclampsia? Well, this is where we discuss low-dose aspirin and how it might help you. Low-dose aspirin is recommended to women at high risk of pre-eclampsia, and this includes 100 to 150 milligrams of aspirin taken at night and started before 16 weeks in pregnancy. We know from large studies and large groups of women that in patients who are high risk for pre-eclampsia, so those who have screened high risk, those who've had pre-eclampsia before or early onset fetal growth restriction, or those who have significant medical risk factors for developing pre-eclampsia may benefit from commencement of low-dose aspirin in a pregnancy. As always, we recommend you discuss this with your obstetric specialist who knows your history best and can guide you as to whether this is the right medication for you. The cure for pre-eclampsia is delivery, but this may carry additional risks if diagnosis is at an early gestation when your baby may be preterm. Close surveillance of mothers with pre-eclampsia is warranted, both to ensure that mums don't get more sick during pregnancy, but also to ensure that your baby is well and is growing appropriately. Particularly in the diagnosis of early onset or more severe pre-eclampsia, the doctors at Queensland Ultrasound for Women can help you and your obstetric specialist in timing delivery and in most appropriate ongoing surveillance.